What's going on, everyone? Welcome to today's pandemic update for Tuesday, May 2nd, 2023. Today, India reports another 3,325 cases, and they have added an additional 17 deaths. I think it's safe to say India has now peaked on cases for the XBB.1.16 wave. Could we see them rise a little bit over the next couple days? Sure, but I don't think we will see them get back to the highs that we saw last week or the week before. Deaths are the last lagging indicator that we will still continue to have to watch. All right, now this. Biden will end COVID vaccine mandates for federal workers and international travelers on May 11th. And I think we should have seen this coming. And I don't know if this is a cover up for something bigger. We know the vaccines are effective against deaths and severe illness, but there has always been a problem since the start of all these new different variants that have come out one by one. There has been a problem with transmission. As you all know, people who are vaccinated can still test positive with breakthrough cases. There's a word I haven't said in a while, breakthrough cases. But technically, that's what they're called. Moving on to our next story, some really sad news to report. Canadian folk singer Gordon Lightfoot has died at 84. You may know him from songs such as Early Morning Rain, The Wreck of the Edmund Fitzgerald. The list goes on. And unfortunately, he has passed away. We do not see any cause of death listed yet, which hopefully we do find out what caused his death, but sad to see that he has basically suddenly passed away because he only became sick not too long ago. We reported that he was sick and canceled his touring, and now he has sadly passed away. All right, moving on to this. This should be really alarming to a lot of people. Heart attack risk soars even after mild COVID-19 infection, study finds. And this is kind of silly. We're getting this information from the Weather Channel. Okay, the Weather Channel has a bureau, I guess, over in India. Well, this is where they're getting it from, their India website. Not from the CDC, the Weather Channel. I learn more about COVID from the Weather Channel sometimes than I do from the CDC. The World Health Organization, WHO, recently announced a 95% decline in COVID-19 deaths since the beginning of the year. So that's good, but let's go down here. Researchers monitored study participants' heart health and indicators of vascular aging in a laboratory from October 2019 to October 2022. Most participants were young, healthy adults aged less than 40 years, including 56 males and 44 females. Among other healthy indicators, about 9% of the group had high blood pressure, 2 participants had diabetes, none had high cholesterol, and about 78% of the study participants were non-smokers. How about what the findings reveal? The findings reveal that COVID infection was correlated with increase in aging arteries, and shockingly, even those with mild disease exhibited deteriorating heart health. That's alarming. That should be making like the headlines of the national news. You know how when we see the headlines, they show all the stories that they're going to talk about in the national news? That should be at the top 3. But here we are. We decide to do nothing about coronavirus, and we just let it rip like there's nothing wrong with it. And we're finding out that heart health is a big issue. We've known it is, but the more we find out, the worse it gets. And anyone, even with mild infection, can get a heart attack. Alrighty, last night the CDC was trending, so I asked, the CDC is trending. If you had to pick one thing, what disappoints you most about the CDC? I may use an answer or two in tomorrow, meaning today's update. And I'll tell you what irritates me most about the CDC. There's a lot of things, but at the top of my list is transparency. And with transparency, that can mean a whole lot of things. Posting data in a timely manner, such as, new variants. How many times have we seen new variants spreading around the world, or even in states in the United States where there were confirmed cases, and we did not see the CDC add it to the nowcast until several weeks later? It has happened numerous amounts of times. Transparency with the risk of COVID. You know, all these different things. We just showed you something that the Weather Channel reported on about heart attacks that couldn't even happen with mild disease. Nothing from that with the CDC whatsoever. It's just utterly ridiculous. If they would post this stuff in a timely manner and be honest and truthful about it, I think a lot of people would have more trust in the CDC. Alright, let's see some of the things that are at the top of your list. I asked you to pick one thing. Let's see what they are. Karistina said, what disappoints me most about the Centers for Disease Control? The fact that they're not controlling disease at all. That they're actively encouraging transmission of a disabling virus in a pandemic that shouldn't have lasted 3 years, let alone 4+ years. Then we come down here to this one. Let's just see here. P100 this way. Does everything count? I think the great unmasking disappoints me most, like that really was the beginning of the end of mitigations and jumping the gun on what we wanted to do before masking. Sure, everyone was as safe as possible. Yes, when we did the great unmasking, right when the vaccine came, that was basically when we said, go out, have a party, you're free to do whatever you want. COVID's over, and we all know it's not over. Then we come down here to this one, Mark Warling. Walensky, how she failed with protecting us. She never told the truth how important N95 protection is. Walensky failure. Yes, I saw a lot of responses here stating that Walensky did a bad job. Let's just keep coming down here. I want to read this one right here. I just saw it. Here we go. Robin and Ruth. I'm horrified. Secretary Becerra didn't immediately replace CDC Director Walensky after she said the quiet part out loud. The person should not have a medical license. Yikes. And if you look here at the picture here, CDC Director Rochelle Walensky told Good Morning America that it was really encouraging news that the vaccinated people dying from COVID were mostly people who were unwell to begin with. That's just a horrible statement to say. You're supposed to be keeping people safe and protecting them from getting ill, and basically you just said, oh well, it's only the people that were already unwell and disabled. No, you don't say that. You are the CDC director. You're supposed to be helping these people. Unbelievable. And it just goes on here. If you want to read some of the responses or add your own response, I will put the link to this tweet that I did on the description down below so you can read some of these responses. I'm sure you have your own opinion, and we could go on with this all day long because the CDC is really a touchy topic. Alright, nothing to report on for this day in COVID history. I do want to show wastewater today. We neglected it the past couple days because not much was happening. Unfortunately, I got some bad news here. Here's the 4 regions of the United States. You have a green one, you have a purple one, you have a pink one, you also have this orangish yellow color. We'll just say gold color. And there's 4 regions. 3 out of the 4, look here, have started to rise. This one up here in the Great Lakes is starting to rise faster than the others, so that's concerning. And remember, sometimes we see them starting to rise, then they drop a little bit again. And this one in the Great Lakes, no, that's a pretty decent size rise that's starting to occur, so that's something we have to concern ourselves with. And taking a look at the wastewater map, not much has updated here. We're still missing some data out of New York State. Usually as we get later into the week, we do get more data. And that wastewater region for the Great Lakes, we kind of figured that would happen. We were watching the sites rise in Ohio. Sometimes the smaller sites rise first, then it spreads over to the bigger sites. Taking a look here at the latest transmission map from the CDC, high transmission is at 573 counties. Substantial is at 410 counties. Moderate is at 1,516 counties. And low is at 624 counties. The latest variant proportion, as you know, XBB.1.5 is at the top, 68.8%, XBB.1.16, 11.7%, XBB.1.91, 9%, XBB.1.92, 3.7%, XBB is at 2.4%, XBB.1.51 is at 2.2%, FD.2 is at 1.3%. Alrighty, taking a look at BNO, we have 2 days worth of data to look at. The weekly update from last week showed 96,111 new cases. The average was 105,688. That's down by 16,075. States reported last week, 49 out of 50. And new deaths, there were 1,468 new deaths. Now for this week, yesterday's update, there were 5,635 new cases. The average did drop again to 13,609. That's down by 121. States reporting 6 out of 50. In the hospital, 13,119. That's down by 246. In the ICU, 1,777. That's down by 6. New deaths are at 87. The average for deaths are actually up by 3 to 213. New Jersey added 119 cases, 94 probable cases, 4 hospital-related deaths. We're still seeing a consistency of deaths each and every day in New Jersey, so that's not good to see. Hospitalizations in New Jersey, 209 people in hospital, 9 people on a ventilator, 21 people in the ICU. Nothing to report from statewide level of Pennsylvania, but in Philadelphia, my county, my city, yesterday we saw a big increase in EMS calls. It was a very busy day for the Philadelphia EMS personnel. 771 ambulance calls yesterday, which is significantly up from the 650 some that they reported the previous day. Let's see, do we get an update out of Center County, Pennsylvania? We do. It just came in. And Center County, Pennsylvania, one hospital there reports just 4 hospitalizations today. So that number is dropping. New York State, 334 people have tested positive in the last 24 hours, 1.1% positivity, and 1.4% is the 7-day average. Hospitalizations in New York State, 658 people in the hospital, 72 people in the ICU. That is up from the previous day's number of 617 people in the hospital. So not good that we're starting to see the Tuesday rise again. Usually when we start to see the Tuesday or Wednesday rise, it sometimes is the beginning of a new wave. We had a false signal of that back in the beginning of April. We'll have to wait and see what happens here. All right, taking a look at some international data today. Internationally, around the world, cases are down 30%, deaths are down 39%. South Korea cases are up 4%, deaths are up 18%. Japan cases are up 9%, deaths are up 11%. France cases are down 17%, deaths are up 1%. Vietnam cases are still up 13%, 4 deaths in the last week. Indonesia cases up 73%. Deaths are up 123%. The Philippines, cases up 71%. And deaths are down 100%. They've reported no deaths versus 3 deaths, so that's not really an accurate percentage, but that's what it is. That's what it works out to be. Qatar, 187% increase in cases. No reports on deaths. Alrighty, and we'll just do one more. Afghanistan, 27% increase in cases. Alrighty, thanks for watching today's pandemic update. Hopefully it was informative. We had a lot of bad news to report on today, such as that heart attack risk. Wow, yeah, do whatever you can to stay safe. You do not want a heart attack from even just a mild infection. No one ever wants to have a heart attack, but yeah, that was really bad news, eh? Alrighty, I'll see you again tomorrow for another edition of the Pandemic Update. Till I see you again next time, stay safe. If you like this, give it a thumbs up. If you want to see more stuff like this, hit the subscribe button down below. Have a great afternoon, everyone. See you all again next time, and thanks for watching.